right, so yeah, exactly. Lies. All right, guys, so we just finished up actually doing a Q&A. One thing I get a ton of that drives me batshit, and I bother Jason with via text, is I get a lot of questions that are well above my pay grade, and I definitely appreciate you guys asking them, and I try my best to go to Jason on ones that can be answered to get the correct answers. But one thing that scares me a little bit is a lot of influencers, bodybuilders, we tend to drift out of our expertise and start giving bad advice and even dangerous advice. So what we're gonna try to do here on a little bit more regular is every now and then when I'm in here, do a Q&A where you guys are asking an expert instead of a meathead how to fix it or what's wrong. So that's what you guys are gonna see now. Check it out. These are some of the questions that you guys asked, Jason's answers. And again, make sure you jump on his Instagram, follow them, continue following me. I'll psych you through, and hopefully you guys can keep getting good information, stay healthy, and keep growing. Excellent. So you just answer the question because it's written on the screen.
Okay.
So I'm going to read it one more time, and then as soon as I'm done reading, I'm going to hit play.
Okay.
Okay. How much do you stretch pre-workout, and what does that consist of?
Never stretch pre-workout because research shows static stretching reduces muscle activation for 30 minutes. So we want to do a dynamic warm-up pre-workout to get the muscles activated. Stretch post-workout. Stretching should happen post-workout after you've heated the tissue up. It'll be much more supple and effective to gain length.
Boom. Okay. Boom. Had a surgery for torn shoulder labrum. When recovered, safe to return to heavy sets to failure?
Yes.
Okay. And you can literally say yes. You don't have to say too much else, but whatever you want. Ready? 3, 2.
The key to post-labral tear lifting is making sure you have full external rotation, but you should be able to go back to full heavy weights lifting overhead post-surgical.
Due to distal bicep rupture repair surgeries this week, due to have it, how soon to start rehab and loading after? So when you're ready?
Yep.
3, 2.
So rehab usually starts a week after surgery. It's going to be very basic range of motion, mobility work for the first 4 to 6 weeks, then progress to light activation exercises.
Daily best practices for healthy shoulder. My AC joint hates me.
Okay, this is a two-part answer. So first thing, you want to see someone to make sure your AC joint is actually moving like it should, so it's not getting beat up during workout, and then aggressive internal rotation stretching to make sure the posterior capsule is mobile, so that way when you're doing pressing and lifting overhead, there's no stress on the AC joint.
Went too deep on the pendulum squat, strained something in the shin or ankle. Any suggestions? The fuck you mean you went too deep? There's no too deep.
You might want to use an orthotic in the foot. You might have flat feet, and as you were going deep into the pendulum squat, just overpronated and strained your posterior tib.
Teres major keeps getting stiff and burns while seated.
If it's burning, usually typical of a trigger point in that muscle due to the accumulation of lactic acid in that muscle, causing the burning sensation. So you need to get it treated. Treatment that you could do on your own, Theragun or Hypervolt, followed by rolling, followed by manual work by a massage or physical therapist, and then dry needling, of course, will be your fastest solution.
Is tennis elbow curable, or just wrap my forearms to get through big workouts?
It's curable. You've had it.
Yep. 3, 2.
Tennis elbow, very curable. Dusty's had it once. A little bit of needling to offload the tendon and help it to recover faster because you're just overloading the tendon through too much tightness in the forearm.
How to rehab patellotendon at the top of the kneecap, bottom of the quad. And thank you to me, even though I'm not answering. You are welcome. So, how to rehab patellotendon at the top of the kneecap, bottom of the quad.
That's a tough question because you need to know how bad does it hurt.
Okay, if it was really bad, what would we say?
Ice and rest.
Okay, so we're just going to say ice and rest, and how long would you rest for typically?
If your pain is above a 5 out of 10, then you want to ice, rest, and take about a week off. If it's below that, say a 2 to 3, eccentric work is best shown in research to help recover patellotendinitis.
Fuck Can't incline overhead at all, rear delt and supraspinatus pain, possible exercises to help. And if it's not an exercise, you can tell something else.
In that scenario, possible labral tear, which will refer in the back of the shoulder. You see a lot of weightlifters get off pressing and they're rubbing the back of their shoulders due to the irritation to the labrum. So that would be something you'd want to rule out before you continue exercising through that.
Can you tell if tight pec minors are tight/strong and don't need trained, or tight and weak and need trained?
Yeah, this is a good one. You've had this one before.
3, 2.
Best way to tell if pec minor is tight is when you lay on your back. Do your shoulders sit on the floor or are you rounded forward? If that's the case, you need to stretch them and work on scapular retraction exercises to get length.
Right lat feels like it's stuck in contraction. What gives?
Trigger point.
3, 2.
Traditionally, when people complain of tightness, say in the lat or anywhere, it's because of a hyperactive trigger point that needs manual work to release so that you're not getting the overdrive of tightness.
What would we do for manual work?
Manual work being Theragun, Hypervolt.
1 sec. I'm going to keep going on that. So, manual work being
Theragun, Hypervolt, foam rollers, vibration rollers, and manual work either by a manual therapist, massage therapist, or PT.
Let's see. Best exercises for rotator cuff, especially overhead movement issues.
Overhead movement issues, I'm going to assume strength. So best is a band going at a 45-degree angle, working a 90-90 rotation to help increase power of your infraspinatus and teres minor with overhead pressing.
Every time I hit chest, my right front delt hurts, but in shoulder days, no.
Sounds like you got a trigger point in your front delt. If you palpate the front and it's exquisitely tender, then you've got a knot there that you need to do some gun work and mobility work to release that knot.
Bad nerve pain. Back and legs during leg extensions. How can I fix?
So unfortunately, if you're getting referral or pain as you're doing knee extension, the sciatic nerve is inflamed and you're going to need either a round of cortisone or some sort of anti-inflammatories to cool that off. Do not keep training on it because it'll only get worse. Nerves hate to be stretched when they're inflamed, so if they are inflamed and you're stretching it, you're going to make yourself significantly worse.
Stretches for L4 disc bulging.
Best thing you can do for a disc bulge, if you know it's present, is the cobra stretch. So going into back extension, trying to get to terminal range, will help push the disc more forward and reduce it off the nerves.
Shoulder mobility warm-ups and downs, please.
Best warm-ups for shoulder movements would be to do A, T's, and Y's to get mid-lower traps firing so you have better stability before your shoulder work.
Good way to get my low trap subscap to release on my own.
So best on that would be getting a vibration roller, one so you can mobilize your thoracic spine, get those to make sure they're moving optimally, and the vibration will help turn the tone down of that tightness in your interscapular area.
Ways to help increase recovery: soreness, massage gun, Mark Pro, I don't know what that is, foam roll, and stretching.
Ice bath. The last thing I would add to that would be ice baths. You're doing everything else right.
What exercise can I do to increase shoulder mobility to comfortably barbell squat?
Best mobility would be external rotation is what you're restricting, so you've got to lengthen your lat and your pecs, which are going to keep you from being able to grip the barbell with a squat.
Okay, how does he always know the spots to treat? Caitlin, because you're awesome. How do you always know the spots to treat?
I can say it.
Let's do it. 3, 2.
How do I know the spots to treat? Dusty, if you focus on my elbow, when I squeeze, you see how that rolls? That's what we're looking for. That's a jump sign. And when it jumps, that's a dysfunctional muscle.
Jason's elbow's dysfunctional, people. Pain in the inside of the elbow. Any suggestions?
One thing you want to look at is make sure you've got full mobility of the elbow, but if you're getting pain on the inside of the elbow, that's a traditional golfer's elbow. Take a lacrosse ball, massage your forearm to get that to loosen up.
Was diagnosed with arthritis in my hip, just turned 60. Any thought on what I should do on a leg day? What's arthritis still got?
Best thing for arthritis is a lot of mobility work. You want to really increase the load across the joint and light loads to increase your synovial fluid production so it won't hurt while you do weighted exercises.
Best stretches to improve ankle mobility. This is a good one. Ready? 3, 2.
Probably my favorite for ankle mobility is a seated calf raise. Load it with 245s, drop your ankles to the floor. That's going to stretch your soleus out, which is the reason why your ankle mobility is not good.
Bulging disc, can you train around it? Best approach to recover, things to help.
Okay.
2.
Bulging disc, you want to maintain your spine in an extended posture through your lifts. That way it'll push the disc more anteriorly and away from the spinal nerves that are causing pain.
What can I do to help my inner knee pain? It hurts when I'm squatting.
Inner knee pain could be a meniscus, but if it's not a meniscus, something simple is checking the length of your adductors. If your adductors are tight, that'll cause medial knee pain, and you just need to stretch them.
Patella tendon hurts on all compound movements. Any tips to help?
See a therapist.
Do it. 3, 2.
With every movement hurting, I would go see a PT and let them assess structurally what's going on and help you with some interventions to reduce that pain.
Pain in lower neck, upper back between the shoulder blade comes and goes. Sounds like you're married. Too soon? It's too soon. Okay, one sec. We might have already nailed most of them. Just want to say these answers are great. Your PT is, we're going to finish with this one. I'm going to see if there's any more real quick. Lots of pain in the right knee while squatting.
Are they seeing these lots?
Sciatic. Will they pop up as we're still going? Okay, so we're going to do 2 more questions. Okay. It'll be left leg sciatic issues, make the left foot numb and back issues. I have no idea how to minimize it. 3, 2.
The easy question or the solution to that is it could be your glute medius or minimus is tight. So when you're squatting, it's causing a referral of pain down the leg and that numbness, and you just need to stretch that and roll it with a lacrosse ball.
Lots of pain in the right knee while squatting. How can I fix that?
That one's a big question, so it could be your kneecap, it could be the meniscus, so I would go see a physical therapist, let him assess to help give you the right exercises to correct that pain.
Okay, and the last
In
one.
my profession as much as possible.
That's good. Just want to say these answers are great, and your PT is beyond any info-wise I've personally seen. So just give like a brief thank you and check out our page kind of thing. 3, 2.
Thank you for the compliment. Glad to be a part here and help you guys through Dusty's Instagram. And if you go check out Kinetic Sports and Spine, ksSpt.com, shoot me an email if you've got any other questions you'd like answered.
Jason, the time was just money, sir. Money.
I adapt.
Done. All right, now I'm going to take down the question board so we can stop asking questions. So part of the key to Instagram, everybody, that I fuck up on all the time is when I'm done answering questions, I forget and I leave that up, and you guys answer me 77 more questions, and I feel like I wasted your time. So I'm sorry.